Hello, welcome to Fitness with Familiar Faces from the Vancouver Parks Board. The goal of these videos are just to get you exercising while you can do it safely at home. My name's Kevin, personal trainer and kinesiologist. If you haven't done the ParQ Plus form, so it's the form we give you every time you sign up for community center programs, you can look online to fill out or check out that form. ParQ Plus, just to see if it's safe for you to do exercise or if you need to see a doctor before you start. So today's session will be on stroke recovery, seated exercises, or exercises to help with flexibility or stiffness if there's balance is off, or you just like seated exercises more. So we go from the feet all the way up. So the first one we're going to go into is into a calf raise. So these are my feet. I'm calf raising up where the heel comes off of the ground. So we're going to try to do 2 sets of 10 for all exercises. If you are recovering from stroke, then you want to do as much movement as you can on the affected side. If there's any pain or discomfort, you don't need to do that exercise. And that's your first set. Calf raises are good to help with picking up the feet when you walk, so it's harder for you to trip or fall. So we go into your second set of the calf raise, raising those heels up, feeling that in your calf muscles, in the back of the lower legs. Perfect. The next one you're going to try, always seated on the edge of the chair, but sometimes it can have a little bit of pain in the low back. You can lean back if you need that comfort. Otherwise, for your core or stomach, back, and shoulder blade muscles, for your core muscles, you want to stay at the edge of the chair. The next one is a extension. For your quad muscles or thigh muscles, which are used for walking up hills, getting up chair, and climbing stairs. So if you are affected by a stroke, I'm showing 2 sets of 10 repetitions, but that's not enough repetition if you are recovering from stroke. The goal is to train the brain rather than the muscles, and the only way the brain learns is through repetition. So that's the first set. So if these exercises feel okay for you, no extra pains, then if you're recovering from stroke, you want to do this 2 or 3 times in the day. So breakfast, lunch, dinner, or once every hour. The important part is just trying to retrain the brain through motions that maybe you can't do right now, but if you keep practicing, you'll be able to regain those motions over time. Second set of our quad extensions, aiming just for 10 repetitions in total. Feeling that in the front of the thigh or quad muscles to give you more endurance climbing stairs or just being able to stand for longer periods. And then one more there. Perfect. So we went from the ankles to the thighs. Now we go into the hips. So sitting on the edge of the chair, your feet come close together, and you try opening and closing. That's called a clamshell. That's for the outside of the hips. Keeping your feet close together, and it's just your hips that open up. Feeling a stretch in your inner thighs and tightness in your glute or outside of the hips. Clamshells are good because it works your glute muscles, which help you with bending to pick things up from the ground or getting up from chair or floor. So that's the first set of your clamshell. You go into your second set, opening and closing. For people that have more stiffness in the hips or the low back, it is a good idea to move those hips. And a clamshell exercise is a good place to start in a seated position. And then last one. Still working out on those hips. seeing if you can go into just a march. You'll feel that in your hip flexors or front of the hips, underneath your quads. Same muscles used as walking forward, stairs, and that's a seated march. If you find that one side is not able to move as much as the other, then that's fine. You just want to do as much as you can, and over time as you keep practicing, you should be able to regain more flexibility into your second set. So feeling that in your front of the thighs, in your hips as well. If you're feeling that in the low back or any pain, then you don't need to do that one. Perfect. Still going with your march exercises, this time seeing if you can tap to the side and come back, tap to the side and come back. Like your clamshell, same idea for your glute or hip muscles. Easiest if you do sit on the edge of the chair. Everything we do 2 sets of 10. First set done. Then we try, when you're ready, a second set. Tapping out and coming back in for your hip or glute muscles. Important to have strong hip muscles so that if you fall or get hit in the hips, the bones don't break. You can have muscles to cushion the impact. So that's just a side march, a seated side march. So then we move up to the upper body. So the next one we're going to do is for your trunk, stomach, back, shoulder blades, hips. Especially if you find that it's harder to move one side, we still want to work your core muscles, stomach, back, shoulder blade, hips. So this one's a shuffle. So you want to shuffle to the back of your chair and you want to shuffle to the front. Shuffling back and forth. This works your stomach muscles or helping you to get up from bed or up from chair. And there's 10. So ideally you want to shuffle with the least amount of the arms, but depending on your chair, if your chair is slippery, then you got to use a little bit of the arms. It's just how it is. So that's a seat shuffle. We'll go for a second set. Shuffling forward, shuffling back. Feeling that all along the stomach, hips. Shuffling on the front of the chair and back. Then we move on still into your oblique or stomach muscles. For this one, you want to bring those arms to the middle. Stomach muscle pulled in, and you're going to see if you can rotate one way, middle, and other side. Aiming for 10 in total. This is the same as shoulder checking when driving. Looking around you if you're trying to cross the street. Feeling a stretch in the low back and tightness in the stomach. Seated twist. It's your first set. At any point you can stop the video, drink water. At any point, if the exercises aren't feeling comfortable for you, you don't have to do them. You can wait till the next exercise. Into your second set of that seated twist. last one. Stomach muscles and stretching low back. The next one we go into is for your shoulder muscles. Especially after stroke, there can be a little bit of drooping on one side. A lot of times, stroke patients want support on their affected side, getting up from chair, but it's actually better to grab the non-affected side if you're supporting someone with stroke. Just because there may not be too much muscle strength here, so we can cause extra discomfort, which you don't feel yet, but may feel later. So try to help people out in their non-affected side. So for that shoulder drooping, we do shoulder blade exercises. So those arms come down to the side, and you try palm up and palm down. So sometimes people do it just the forearm, but you have to do it from the shoulder, and that will help with posture, especially people that have more of a drooping shoulder or rounded shoulders. Feeling a stretch in your front shoulder chest and tightness in your upper back or shoulder blades. And if you can only do one side, or it's easier for you to do one side at a time, go for it. You would go 10 on one side, moving from the shoulder joint, and then 10 on your other side. Can be done together or can be done one at a time. To help with posture, rounded shoulders or slouch shoulders. Perfect. Still working for your shoulder blades. The next one you're going to try is just seeing if you can reach behind the back. So level 1 is reaching low where your glutes are. Level 2 is reaching around mid-back. And level 3 is trying to reach for the shoulder blades. But that's a stretch for your rotator cuff. It's normal to feel tightness along the side of the shoulder. But sometimes if people reach too high or reach for too long, then they start feeling pain. So you want to stop before you reach that pain point. Then you go to your other side, just reaching. Lower where the glutes are, level 1. Low back, level 2. Trying to reach for your shoulder blades, level 3. But still trying to stay tall rather than bent forward, staying tall. Good. Then we move on to your front shoulder muscles. So being able to reach up high or reach in front of you. So level 1 is seeing if you can cross the arm and raising back and forth. Feeling that in your front shoulder muscles. Aiming for 10. If you find that one side is just unable to move, you can carry that side. So if it's my side here that is affected, underneath and up I go, pushing with my non-affected side. Pushing with my non-affected side. For your front shoulder muscles, so you can push, carry things in front of you, carry your grandchildren. And then last one. Still going for the shoulders, still going for your neck muscles. So for shoulders, the next one arm at a time, is just pushing and pulling. Can be done both arms or one arm, especially if there's less mobility on one side. For your front shoulder and chest muscles when you push, and for your back posture muscles when you pull. Then you try your other side, pushing and pulling. We do 2 sets of everything, so when you're ready, you go into your second set. then your other side. 2 sets of 10 for all the exercises. And if they feel comfortable for you and moving is something you need to do a little bit more of, stroke recovery, you got to try to do this at least 3 times a day. It's about repetitions in the hundreds. So 10 reps, 2 sets, 3 times a day. It's already 60 repetitions. So you're almost there. And you release. Going into your neck muscles, especially people when after stroke, droop shoulder, forward neck or rounded shoulders. So to help with that forward neck position, we show a chin tuck. So a chin tuck is just about making a double chin, bringing your neck behind you. Breathing in and breathing out, feeling that tightness in the front of the neck and a stretch in the back. You can hold it for 10-15 seconds, feeling that stretch all along the back of the neck, releasing. Or you can go back and forth, tuck and back, tuck and back. Always breathing in and breathing out as you normally would, feeling that stretch along the back of the neck. And that's for your forward neck posture. Good if there is neck stiffness in your traps. Then we go into some stretches also for posture. So going into just a shoulder or chest stretch to help with rounded shoulders, to help with drooping shoulders. So if you find that both sides is challenging, then that's fine. You can try opening up with one side, feeling that front shoulder chest stretch. So if you go too far, it might be uncomfortable in the back. So you just want to start until you feel the stretch, and then you stay there. Switching sides, opening wide. And then you'll go into a second set, whether that's one arm or 2 arms. And that's to help with drooping shoulder, rounded shoulders. And then you release. So that's a series from your ankles or your feet all the way up to your neck to help regain some more mobility. If there's no pain or discomfort, feel free to do these exercises. If there is any pain, don't do them. Stroke recovery, try to do this 3 times a day, breakfast, lunch, dinner. And they don't have to be all done together. If you want to do some feet exercises at 1 p.m., and then some chest exercises at 2 p.m. You can split up your day. That's no problem. It's just about the total repetitions of exercise that you do in your day. If chair is uncomfortable, try laying down on the bed or on the couch. You can still do these exercises laying down. Otherwise, stay tuned for more videos from City of Vancouver, Fitness with Familiar Faces, or you can just follow this channel here and you can get more fitness videos from there. Watch out for our Zoom classes held twice a week. It's like Monday, Friday, 11:30 a.m., but that's subject to change too. So watch out for the Zoom. If you have any questions about live classes or any of these fitness videos, leave a comment, email, or through this channel. All right, this is Kevin, personal trainer, kinesiologist, signing off. Thanks.